Our camera people. So, do you want me to wait a minute or two for this bus? They're asking maybe to hold it off a minute or two because there's a group of people.
I could see myself. Okay. I'm on the top. I can see people.
Is your sound working?
Hi, ladies and gentlemen, can you hear me?
Yes.
Great. We'll be starting in about 1 minute. We're just waiting for some people to get situated from the well. Thank Thanks for your patience.
Welcome, everyone. I am Ralph Ortega. I'm the editor-in-chief of City and State. Welcome to our event today, sponsored by AARP New York. It's entitled Live from the Well, Legislative Forum on New York's Caregiving Crisis. And with that, it's my pleasure to introduce State Director of the New York State Office of AARP, Beth Finkel.
Thank you. So excited to be here today. You'll notice there are empty chairs here because our bus got delayed. They'll be here soon, but I'm sorry they're not going to hear me say this celebratory announcement about the One House bills and including the 45 million. We couldn't be any more thrilled for home and community-based care. And we know that this is just a baseline moving forward. It's the addressing the wait list for what it is now. And we know that in real time, we're going to be continuing to do that so we don't see a wait list for people hoping to get home care to keep their loved ones in their own homes. Because we all know that New York State's aging population is booming to the tune that 1 in 5 New Yorkers are now 65 plus. That's more than children 15 years old and younger, which is the first time that this has happened in our state. So there are more than 3.5 million New Yorkers that are 65 plus. So by doing this, our state legislators, our heads of the Aging Committee, Cordell Clear and Rebecca Seawright, have stepped up. They understand better than anybody else the plight of the caregiver, and they have put their capital, they have put their power behind that. And honestly, we just can't thank them enough. So thank you. And we have to thank the governor because it was in her budget. So we're very excited that everybody is like-minded and understands the priority of this work. Statewide, there are thousands of middle-class individuals and their families that are waiting. There are 16,000, but it's 20,000 actually units of care that people are waiting to get. So they will now not have to worry about getting their meals delivered. They will now not have to worry about having transportation to a doctor's appointment and chore services and so many other things that allow people to age with dignity. So we do have an ask going forward, though. There's still the 44 million that we needed to keep up with inflation numbers. We haven't let go of that, and I know you're going to hear more of that from our panelists. I want to thank the volunteers that are here now and the rest that are going to be coming down the stairs shortly. We'll have to give them quite a fanfare because their bus had quite a bit of difficulty getting in. So anyway, without further ado, I'm going to hand it back to Ralph, and I thank you all for coming. And one more, thank you so much to our legislators for doing this. It's extraordinary. Thank you, Ralph.
Thank you, Beth. And it's a great honor that I'd like to introduce my colleague, Austin Jefferson. He is the Associate State Politics Reporter for City and State. A round of applause for Austin. Take it away.
Thanks, Ralph. Yeah, thanks for coming, everyone. As you said, my name is Austin Jefferson. I'm the Associate State Politics Reporter for City and State New York. Sitting to my left is Bill Ferris, AARP's New York State Legislative Representative. We have Senate Aging Committee Chair Cordell Clear.
Talk to you about the letters.
Live on New York CEO.
Did that matter for that reason? There were
Assembly Aging
people
Chair
running.
Rebecca Seawright and Association of Aging Executive Director Rebecca Clear. So I think just to kick things off, I understand there is some good news in this year's One House budget around caregiving. Would the two chairs like to, I guess, talk about that a little bit?
Okay. I like to describe us as chairs of the aging committee, not the aging chairs. Good afternoon, everyone. I'm New York State Senator Cordell Clear. And this budget is an exciting budget for us. Not just for the long-term care ombudsman program, not just for what we've been able to get to help close the wait list. I think this is a great start, but we know there's so much more that's needed, and we have to continue to press. And as Beth mentioned, with our seniors basically being the fastest growing population in the country. In New York State is a very large population. And I always tell people, if you're lucky enough, one day you will be there too. So it's something that we have to support, and we have to make sure that we're taken care of. One of the things I'm really proud of, because we have such a growing aging population, is what we were able to accomplish in terms of senior housing in the budget. Housing is one of the biggest, it's one of the most critical factors in the state right now. And across the state, we need to pay attention to it because we just don't have enough of it. It is not affordable, what is existing. And especially in New York City and in the 5 boroughs, we have to make sure that we're preparing for our older New Yorkers to live somewhere. So we were able to do $30 million allocated in the one house towards senior housing in New York City, and $30 million outside of New York City. We were also able to secure $20 million in senior supportive housing in New York City. Yeah, very important. So those are just some of the things that I'm really proud of that we were able to get accomplished and focus on to make sure that our older New Yorkers can age at home affordably.
In terms of Seabright, I mean, how did things fare in assembly negotiations and budget crafting around sort of bringing more funding and more attention to caregiving for seniors?
Well, thank you, Austin, and thank you for your vital coverage of our work in Albany for city and state, and for moderating the panel, and Beth, who opened up from AARP. It's an honor to be here with my Senate counterpart, Senator Cordell Clear, and fellow panel members who are icons of aging, Rebecca and Bill and Allison. As chair of the Assembly Committee on Aging, I'm particularly pleased to be here this afternoon as our budget is being formed. There's no better time to have this conversation on the caregiving crisis. 2.2 million family caregivers are spending on an average of nearly 20% of their income on caregiving. So to combat this crisis, I'm pleased to be sponsoring, along with Senator Clear, legislation to require the State Office of Aging to include in their annual report to the governor and the legislature a report on individuals who are caregiving for older adults. The cost of caregiving are largely underreported, and to address this issue, we've got to understand it and know the facts that surround it. So ask all of you while you're in Albany to have your legislators sign on as a co-sponsor so we can get this bill through this session.
And I'm sure for everyone, this $53 million appropriation is just really pleasing news. Did I get that figure right?
Yes, 53. Total appropriation.
Right. Yeah. I mean, is that a game changer long term, or is there sort of is this the first step in creating a better foundation for care going forward?
I'll answer that first. I think it's a good first step, and from ARP, thank you to the 2 aging committee chairs. And so it is a first step because the population is growing, and a group in New York City, the Center for Urban Future, had a stat that was very interesting to ARP, that there's 3.5 million adults over the age of 65 right now in New York, and that's 30% more than it was 10 years ago. So Austin, yes, it's a good first step in ARP's opinion, but the population is aging, and we are going to go back to you next year and push for more money and for the older persons in our state. So I would leave it at that from ARP's perspective on that 53.
Allison, I mean, how do you feel about it?
Sorry, I'm having a hard time hearing.
Oh, sorry. Allison, how do you feel about it?
About the budget? Is this on? Is this on? Yes, okay. I'm so thankful for the funding. It is not acceptable to have tens of thousands of people on waiting lists. Like that cannot happen in this state, in this day and age. I am so thankful to the leadership of the chairs. I, however, think it is a down payment and we need significantly more funding to reconcile with population growth and the needs that I see that our members have in communities every single day. So I think it is a first step, which hopefully of many more steps to implement what is needed in this state.
And that being said, Rebecca Prev, specifically, I guess what sort of lessons can be learned from the past several decades of, caregiving policy in New York? And I guess how can we improve on that, especially with this year in mind?
So I think to everyone's point, right, we need to make sure that we have a service infrastructure that supports caregivers, especially working caregivers, because they're really the backbone of the economy. I can speak to the services that are provided through all of the local offices for the aging. There's 59 of them in the state of New York. They are extremely low cost, very high yield programs that save Medicaid hundreds of millions of dollars per year. And the state really needs to focus our attention on how we can support the individual plus the caregiver in that family unit. Through robust services that keep people off Medicaid, keep them out of skilled nursing facilities in their homes and communities. And the reason for that is not only it's the right thing to do for the population, but from an economic standpoint, you want to keep people in the state of New York. Older people, a lot of people don't realize this, older people pay $72 billion per year in state and local taxes, which is over 40% of what New York has in tax revenue. So it's really important that we keep people in the state. And to Allison's point, the fastest growing segment of the population in the state of New York are individuals over the age of 80. But we're seeing population gains in the 60 plus population, but we're losing in every other demographic. So we're losing caregivers for older individuals in the state. And we really need to look at Office for the Aging programs, which have been around for over 50 years. We know they work. We need to fund them to be able to support people in the community.
I mean, you mentioned how, the aging community pays, you said 40% of state and local taxes. I mean, are there any, I guess, misconceptions or things people don't realize as, as everyone here advocates for the aging community in New York?
I think the biggest misconception that we see serving the older population is that this population is a dredge on society and that they're takers. The absolute opposite is the truth. So unfortunately, in advocacy, we have to talk about those people that have needs because that is a real, it's a real issue, not only in the state, but also nationally. So we're always talking about people that need home care or need a home delivered meal. The vast majority of the older population in the state of New York are very healthy. They are volunteer based. They're givers to philanthropy. And we look at this as an equity issue that older people are deserving of these services and supports. But the misconception that aging is a problem is exactly that. It's a misconception.
And for the aging committee chairs,
Thank you.
I mean, yeah, even when dealing with your counterparts in the chambers, I mean, are there things that sometimes they don't fully understand?
I think we have to clarify a lot of things. One of the, a bill that I had worked on for many years, and I'm still gonna keep on working on it, even though the governor has now taken it and made it a officially in office for workforce, the aging workforce. That's a bill that I've carried for, since I've come into the Senate. And it's so important because many of our seniors are working. Our older New Yorkers, many are working. And some of it is because they want to work, which is great. We love them. They know where everything is. They're reliable. And, but also some of them sadly feel that they have to work. And that has to, people need to know that, and we need to make sure that we have space for them in the workplace so that they can get accommodations that they need, so that they can know, where they can go if they feel like they're being discriminated against, where they can get technical support and other things that they would need. So that's very important. And sometimes that's something that we have to bring across to our colleagues. And, even some of the legislation in the One House that we're doing now, raising the amount of money that our public service workers who return to work can get when they are working in public service. We want to bring them in. So all these things are things that we just, because I feel that sometimes our older New Yorkers are invisible. We have to make sure we're educating not just our colleagues, but everyone on the very important things, some of which were mentioned here today. Rebecca, Beth said it well, this is a very, very big, important tax-paying base. And we have to make sure that people recognize that, also, right now I'm really advocating for help with seniors on property taxes. We have a lot of older New Yorkers who are finding it hard to stay in their homes because as they get older, the property taxes go up, but their income does not. So these are all things that we have to make sure that we're bringing attention to and working very hard on to resolve.
An assembly member? Oh, sorry, an assembly member?
Sure, thank you. As we talk to our colleagues or in the assembly and as Senator Clear has said in the Senate, I share with my colleagues some of the things that I'm doing back in my district office. I have a very busy storefront office located right next to the post office, and our office will pay for seniors that want to volunteer to become notaries. We have a very busy free notary service that we offer, and our seniors love to be notaries and have their notary license renewed or to apply to become notaries. We also offer a senior housing fair and have a free pro bono senior housing attorney specialist. So I think it's very important to have awareness around the issues with our colleagues and the various legislation and bills that we're supporting and sponsoring. I have one of the largest assembly districts in Manhattan for the largest population of seniors. So I feel it's very important to have a very aggressive volunteer program, and we are getting positive feedback from it in our office.
So how have you all seen the prioritization of caregiving change? I guess both from, a political standpoint within the legislature, but also just as far as, how state agencies and the government itself use it.
I would say this $53 million appropriation in AARP's opinion is a real recognition of the aging population and what the family caregivers needs are. If you look at the programs that the senator and the assemblywoman have pushed for in conference for this money, it really is to keep that elderly person in the home as long as possible and to help that family member do that. And so with this money and this appropriation and it really recognizes, in AARP's opinion, the role of that family caregiver, the importance of these programs that Becky and Allison administer in the city and upstate New York to really, we think it really has put the caregiving, front and center. And as we discussed before, it needs to stay front and center because we can't go back to the prior years of getting small adds to the state budget because it just doesn't do it anymore. So it's a good spotlight on the issue.
Sure. So, no, I was just going to add that one of the things we have to do too is recognize that caregivers, home caregivers, and others who do this as a job, we have to pay them. We have to give them a fair pay. I mean, so many, go ahead. I know so many people who leave their homes, leave their family to go take care of someone else, and they're not making enough to support their own family. And the people who do this are good people. I see the relationship sometimes last even beyond. They become a member of that family. And if they're not able to get paid, that's horrible on our part, that we don't give them the pay. And it's not going to encourage other people to go into that profession. We're going to see a shortage of people because they just can't do it. And we have great people who can do this work. I come from a family. My mother did this work. I thought they were related to us. Every holiday, there was care. And I became a caregiver for both my parents before they transitioned. I know the work that's involved. I know the care that's involved. And I know that the people who do this work really care about what they're doing and they should be paid. And we have to continue to fight to make sure that they're getting the wages they need to take care of themselves and their own families.
So Allison and Rebecca, I am wondering too, how does, I guess, the regionality of caregiving, I mean, do needs change, say, in the North Country or Western New York versus New York City or Long Island? Or is it are these issues sort of broadly there?
The caregiving issue is broad across New York State, but across the country. For professional caregivers, as the senator was talking about, the barriers and the issues might look a little bit different in rural upstate New York versus, where an aide could go into an apartment complex and work for the full day. In upstate, an aide might be driving an hour or two in between cases. But the base issue for working caregivers, paid caregivers, and informal caregivers is the same thing. They're not valued and they don't have appropriate resources to support their care journey. On the home care worker issue, this is something that was on the front page of the New York Times in 1986, that we were at a crisis. I argue the crisis is much worse now, and that's due to unfair wages. And Fair Pay for Home Care absolutely could address this issue. It's been very well studied. There's a CUNY research report that actually shows it would cost about $4 billion to implement Fair Pay for Home Care, which is 150% of the regional minimum wage. But the economic spillover benefit for the state would be double that. Because if you pay a home care worker, you're giving them employment, they're purchasing goods and services, they're buying a home, getting an apartment. So there's economic spillover. On top of that, if we don't have a caregiver workforce, you're going to see a population that's driven out of the state or institutional settings, and the math just doesn't work. We have almost 5 million people over the age of 60 in the state of New York. We only have 111,101 licensed skilled nursing facility beds in the entire state. So there is no institutional setting for people to go to. And when you add to that the fact, if we continue to push people on Medicaid, we have an unsustainable budget. So the way to solve those issues is to fairly pay workers and also support caregivers that are doing it informally. Because they are not only supporting the state of New York, they pay $7,000 more per year in their grocery cart as a caregiver. They're missing time at work. And what we have found in the state of New York, that almost half of all caregivers have at least one adverse mental health issue or are using alcohol and substances to cope. So again, it touches the entire care economy.
And I think to emphasize on what Becky is saying, and to go back to your question about priorities, while the funding is integral, and this is an intro step for what is needed, the money and the political priorities have to be like categorically higher. And that looks like bringing up aging and caregiving at the state of the state. That looks like every single initiative, whether it's increasing a benefit to people, there has to be a component in which it talks about how it affects older New Yorkers. And we are so not there. We are not there. We're talking about how people spend a quarter to a third of their lifespan. And if we care about the humanity of New Yorkers and Americans, then we have to prioritize what that looks like. And that means helping people not only get a fair wage, but understand where they can get housing. People just assume that as they age, there's going to be services, right? That either in New York City, there's 500,000 people on waiting lists for affordable senior housing. That's right. The older population is the fastest growing population of people who are homeless. So like it doesn't exist. We have skyrocketed our longevity. People are aging differently than they did 40 years ago, and our systems are not built and are not keeping up. So unless we address that and think about how as an aging state and nation, we're going to change how we think about humanity and what we give back and what we can provide people, like it starts there. Like we have to have those priorities straight before I forget the question. I've gone on a tangent.
Good answer. Yes.
I mean, at the risk of bringing more pessimism to Albany, I mean, what's the, I guess, doomsday scenario if that prioritization doesn't happen?
I mean, if the state doesn't prioritize keeping people at home and supporting caregivers, there's not a lot of options. And I think Becky mentioned it, is that families will be forced to have conversations and forced to make a decision to put their older family member in a nursing home. And from working with AARP and surveying our membership, the last thing an AARP member and when we talk to our members in various ways, the last thing they want is to go to a nursing home for long-term care. So you have the people don't want to go to nursing homes. And if the state doesn't step up and support family caregivers and programs within the Office for Aging, there'll be no choice for people. They will put them in a nursing home because they have no other options. And to AARP, it's tragic that a state like New York doesn't take the time, the effort, and the policy to invest in older New Yorkers and their family caregivers, with the exception of this year is probably the biggest amount of money we've seen in a long time. And it's going to cost taxpayers money if an individual goes into the Medicaid system, and it's a lot cheaper to keep someone at home and out of Medicaid and off Medicaid or into a nursing home that's largely funded by Medicaid. So it just doesn't make sense not to pay attention to this population.
I would just highlight what both of you just said about us making sure that we focus on it. You know, in this year's budget hearings, you know, I asked NYSOFA, is there any one place where we even know what we're doing for our older New Yorkers? And there isn't. I have to comb through the housing section. I have to comb through the health section. I have to comb through every section to find out what we're actually spending on older New Yorkers. We have to centralize that. We have to understand, yes, they need housing. Yes, seniors need, older New Yorkers need a different kind of mental health. We have to focus on geriatric mental health. We have to focus on even the homeless population. Our normal shelters, which we don't want to have to, but have people go to, but they are not fit. They don't accommodate our older New Yorkers. So all of these things have to be streamlined, and we do have to target that population, which is why I keep pressing for master plan for the aging. Where is it? When is it? This is what everybody put. There were so many great contributors and feedback that went into this plan. We need it. Where is it? And so that's something that I'm hoping that will soon happen. And that would solve many of the issues because you had input from seniors, from older New Yorkers, from caregivers, from service providers, healthcare, everywhere put into that master plan. And we really need it to be released and implemented.
I mean, I guess, what do you estimate what it'll take to get that plan out there?
To get the plan out there.
Yeah.
Kathy Hochul. You know, I think it is done. We have done our part, and we want to see what it is and get to what it takes to implement that. It's so important. Older New Yorkers are New Yorkers, and everything that affects everyone in this state affects older New Yorkers. You know, when I look at and I listen to some of my colleagues, constituents, as I go around the state, learning all of the challenges. You talk about rural areas. Transportation is an issue. You know, in New York, we call it stress-a-ride, but they don't even have an access-a-ride in many other parts of the state. They don't have the ability to get to doctor's appointments, to get to the places that they need to go to. So we have to really, really take a look at that. These are age-old problems. These are long occurring problems, and it's time for us to just make a decision now that we are going to address it. This is nothing new. This has been happening, and I think it's just been neglect for many, many years. And as was said earlier, this year we paid some attention to it. I don't want to get ahead of ourselves. That's great, but we're playing catch up. We need much, much more.
So, I mean, I think, correct me if I'm wrong, but it sounds as though the legislature is taking a wait and see approach to, I guess, how the federal government might affect some of our funding sources. So, I mean, what do you all, I guess, want to see to make sure that we have our bases covered, just in case something happens, in order to protect, I think, both seniors and the caregiving economy?
It's really hard to hear.
Oh, gosh.
Yeah.
There we go. Yeah. So yeah, I mean, I think the specter of, cuts to federal funding sort of looming, I guess, what do you all want to see to make sure that New York has its bases covered to ensure, care can be provided for senior New Yorkers, and also just that the caregiving economy is protected?
I can speak for the local offices for the aging. And so we work really closely with our partners at the New York State Office for the Aging. We actually have a comprehensive, detailed report that Commissioner Olson did that literally shows how many people would lose services if there were cuts to the Federal Older Americans Act. We're hopeful that we won't see those, but it would absolutely significantly impact the number of people we're serving, and that would be in every service delivery system. So that's everything from home delivered meals to personal care workers to transportation. I will tell you, the federal government gives the least amount of money to aging services. The state gives the second. The localities are picking up the cost of much of this care because those are local governments that have a responsibility, and they see their constituents every day that need services. So outside of our network, the potential changes to Medicaid and cuts to Medicaid will flood and inundate the Office for the Aging Services network, because if you can't get a benefit on Medicaid because your Medicaid's been cut, you're going to come to your local Office for the Aging for those services. So we're watching it very carefully. And I think whenever you talk about policy and budgeting, to Allison's point, we see ageism within those documents, and you fund what you care about. And we have been underfunded historically for decades. And I will also just mention, we're so thankful for the investment in this year's budget. It's the biggest investment in the history of the New York State Office for the Aging. But we're not serving people at the highest level of care. So that's not receiving meals 5 days a week, 2 meals a day. You might get 3 days of delivery and some frozen meals. So again, there is so much more that we could do to enhance our service delivery system for the individuals that we serve. And to give you a snapshot of the typical client that we serve throughout the state of New York, our average client is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions like diabetes, congestive heart failure, and needs hands-on assistance with bathing, toileting, dressing, paying their bills. We serve them on average for 7 years for less than $10,000 per year on aggregate. So why the heck wouldn't you fund services that are that cheap versus that person going to an institutional setting at the tune of $150,000 per year on Medicaid? So we really need to right size the investments for the older population as the older population grows.
Just back to what the senator said about the master plan for aging, a plan like this, AARP agrees, where is it? And it probably should be released soon, but that plan really isn't worth the paper it will be written on unless there's resources to back it up. I mean, there's so many government reports that are done in Albany, and there's a lot of government reports that are never done in Albany, even though they're required by law. But, we do have faith that the administration will release this report, but they have to put resources behind it. And they can do that with the following budget next year. And like we discussed, it's only a first step of the 53 million. The master plan for aging will be another big step, but they have to put resources behind it. There will be just another document on some shelf in Albany.
Can I list 2 things? I think first, like the very basic services have to get funded, right? If the state is falling on its commitment to its residents, then it doesn't matter what happens. It does matter, but that is like the most important thing. Local things matter. And so without the federal government, we have to lean into what's going on locally. These are our neighbors and our community members. So that's number 1. Number 2 is the state has to pay its not-for-profit partners. The not-for-profits are an arm of good governance, right? They do a lot of the work that the state has decided and local municipalities have decided has to get done, and yet they don't get cash for years. And so if we're expecting Meals on Wheels programs to be resilient in the face of federal cuts, if we're expecting senior housing to continue to have people showing up and being able to have security jobs and home care jobs, then we have to make sure that those providers, which are part of the fabric of good government, have the resources so that if the federal government claws back resources, they can still stay in business. So I just want to make sure that's on the table too.
Along with that, I'll just have to say that, I believe that all our voices need to be lifted, including those on the federal level.
Mm-hmm.
And that's what I want to see. And I know our Senator Gillibrand has been out on the front lines talking a lot about it. But this is something that affects every district, every legislator, everywhere. And I just would like to hear more voices lifted up for our seniors. And as it was already said, yes, the federal government does give the least amount, I think, but we need that and we need them to give even more. Older Americans built this country. It was built on their backs. And this country, this nation owes it to them at this time to make sure that they are getting the best standard of care that we could give. So it has to become a priority for all of us.
I mean, Chair Seawright, sorry. Chair Seawright, how would you make that argument to, I guess, someone doesn't understand, the priority that should be placed on caregiving and our seniors?
Well, again, I'll mention, awareness, having rallies, press conferences, and wonderful important forums like you have today, and all of you who've traveled to Albany on, I assume, buses, and have come to speak to your respective legislators about this. And I'm so glad that you mentioned our nonprofits, because we do need to do funding and grants for our nonprofits and our community-based organizations who provide so many services that are so valuable. So when we see these cuts coming out of Washington, I think it's very important that we continue as a state to issue grants to our nonprofit organizations.
I'm curious as well. I mean, how stable, I guess, is that sort of statewide nonprofit sector for the aging community? I mean, are there, I guess, on top of, I think, the literal policy questions, I mean, are there questions of funding as well that you'd all like to see addressed?
I mean, there's many, this could be its own thing. I think, the issue is often that the government pays very, very, very slowly, like really painfully slowly. So we have, Live on New York has 130 members. They run about 1,000 programs. And so some of them take out loan after loan after loan to make payroll so that they can continue to run the services, because they never get the money. So, and that is a function of the agencies not having enough staff, right? Like the state and local agencies not having, it is a chronic problem. We also need to make sure, like home care, that our boots on the ground, our service providers have a livable wage. No one should be aging into poverty, right? And so making sure that those not-for-profits have the information they need, the skills they need, so that they can partner with their community members, and that older people in each community can weigh in to what they want to see. Because just because something's been done for a long time doesn't mean that that need doesn't change. So having the whole kind of robust service system be able to be as resilient as possible is really, really important. We saw that in Hurricane Sandy, we saw that in 9/11, saw that in COVID, like those things continue. And so making sure that that's really solid is important to ensuring service levels across the state.
There we go. Ageism came up earlier, so I'm wondering too. I mean, how do we combat that, and that sort of outlook that this issue and issues surrounding it shouldn't get the utmost importance?
From AARP's perspective, today, we didn't think in the past years that the aging services got its due, so to speak. And so one thing that AARP does to dispel and move the aging agenda forward is through the power of our volunteers. I mean, for an example, a lot of volunteers got on a bus 3-4 hours ago to come to Albany and visit their legislators. That's how we combat, against ageism and trying to put aging issues front and center. It's always with AARP, it's always our volunteers to raise the issue. And we've been successful at doing that over the years. And I think with the help of the Assemblywoman and the Senator, I think a lot of that paid off, because we've been lobbying this issue. And now we have, as Becky said, an unprecedented amount of money in the state budget. I'd like, I don't want to take all the credit for AARP away from the other advocates and our elected officials, but I think it's the volunteers of AARP that have really pushed this issue over the years. So it's always a good thing when that happens, to fight ageism and the lack of support for the aging community.
I understand elder theft is a really big issue for your members. I mean, there's some proposals coming out this year. I'm curious, what did you want to see in this year's budget?
You gotta repeat the question, I'm sorry.
I understand elder theft was an important issue to you and your members. So I'm curious, what did you want to see in this year's budget?
Well, there was very good language in the governor's executive budget to counter a lot of elder fraud scams. And really to stop that crime where it really begins of money coming over the counter in a bank. With a scam artist or fraudster trying to get that older person to take the money out. And give it to them, supposedly for a problem with a grandchild and such. But it was really good language to combat elder fraud. And we will look to the legislature to try to include that in the final state budget. If it's not in the final state budget, we'll seek to have a standalone piece of legislation. But also there was money in the one houses that did have elder fraud money in it. But the big centerpiece of elder fraud, we have to get done in this budget. And the elder fraud in New York, according to the FBI, I believe was in 2023, $200 million that is lost of New Yorkers, 60 plus to elder fraud. So it's a very important issue to AARP.
Yeah, I mean, I understand there, as you said, there wasn't, I guess, the language that out there before around it. But I mean, do you foresee any, I guess, policy coming out in the future around this?
Yeah, I think we're passing a package of bills today, maybe even around elder fraud and elder theft. We've done many, even when it comes to deed theft, even when it comes to reimbursement for food stamps, for many that get people are experience fraud through their EBT cards that get hacked into, and we tried to make sure that, especially when it comes to our seniors, that their benefits are replaced immediately, that they don't have to wait until there's an investigation while we are looking into the causes of that. But it's, as technology grows, the problem grows for all of us, and we just have it's something that we have to continue to combat. But I do thank our Attorney General's office, our local DA's offices. We have many programs. I give workshops all the time. I believe Assemblywoman gives workshops. We try to keep our community, informed. We have brochures, mailings we send out. I do several senior events every year and bring my seniors together. And AARP has been a dynamic partner in that, that we can count on to really keep our seniors together, keep them organized, keep them informed. They show up, and there are other groups, of course, that are not here today that are also doing this kind of work. It's about information as much as it's about legislation. It's also about informing people and making sure they're aware of what scams are out there and what they need to do to prevent it, who they can call. I have a senior resource guide that I give out for my district, but I think I'm going to have to make a statewide one because people are calling me from other places. And I keep telling them that's just for my district, but we may be able to put something together. But it's about having the information in front of you. And why I mentioned the guide, not to be funny, but people often like to really look at something on paper, as opposed to if we tell them go online to a website or call somewhere, because sometimes it's difficult to tell, even when you're online, what's real and what's not. And you can get frauded in that way. So I understand that too. So that's why I try to print something and have it available for everyone. But yeah, we are paying attention to a lot of the scams that are going on, and they change by the day, by the minute. Mm-hmm.
Did you want to add something?
I had a constituent, an elderly woman, came to my district office and had been completely wiped out of her life savings through a fraudulent phone call. So we held a press conference, helped her get her money back. And now we're looking at legislation that will give banks the authority that if they see an account emptied quickly or it's suspicious, that they can have the legal authority to stop it. And so I think whenever we see something like a hurricane and a big push for philanthropy, especially targeting the senior community, I've had so many seniors tell me that they've gotten calls from the IRS and Social Security asking for money. And I said, they're not going to call you. So just hang up that phone and don't engage on the telephone. But in terms of legislation, we're looking to get that in the executive budget. And if it's not there, then we will offer standalone legislation specifically dealing with fraud of seniors. So while you're all here, your assignment is to speak to your legislators, get them to push for this in the final state budget.
And I would just add in one component. Lifespan of Greater Rochester runs the statewide enhanced multidisciplinary teams for elder abuse and neglect. What we have found through study after study, and we hear it anecdotally all the time, only 1 out of every 6 mistreatment or abuse cases are ever reported. So we have a problem that we don't even have our arms around. And unfortunately, every year we have to fight for Lifespan of Greater Rochester to receive their money for elder abuse prevention and mitigation. And again, we need to baseline that so we can prevent older New Yorkers from ever being exploited in the first place. There's been some investments on the back end to try and get retribution for individuals. Again, why aren't we preventing this in the first place by really investing in statewide campaigns that are addressing this to educate the general public about what to do and what not to do, because it's a massively growing issue.
So I think we've talked a lot about some of the, solutions that could, I guess, help with the caregiving crisis in New York. But I am curious. I mean, I'm sure you've all, heard very specific stories of like, where these things go wrong. I mean, yeah, like, do you want to go down, like, can we go down the table? I guess everyone share, I guess, yes, a reason they've heard from a constituent or a member of the organization that sort of crystallizes why we need to see change on this front.
Talking about with
With,
fraud.
with caregiving.
Oh, with caregiving.
Yeah.
Sure, I can start.
You go ahead.
Would you mind repeating?
I've said a lot.
Would you mind
Yeah.
repeating
So
that?
I mean, is there, I guess, a story you've all heard from either a constituent or a member of your organization that sort of crystallizes why the caregiving crisis really needs action?
Yeah, I've heard a lot of stories. I mean, people don't get the hours of care that they need. It's very difficult on families. And then the quality of people is important. In my district was a very sad story of an elder who had been, an older New Yorker who had been abused by someone who came in that was supposed to deliver care. We have to make sure, again, that we're not just, it is such a crisis to the point that even the quality of care is impacted because we're just picking up people and getting people from everywhere that maybe haven't been vetted properly. I mean, you could pretty much look at this person and see this is not the person that should be caring for anybody. And I think, I can't remember who said it, but we are not delivering the highest standard of care. I know what high standard of care is because I took the time and had the ability to do it for my parents. That is the type of care that everybody should get. Everybody should get. And it should be care that has dignity, respect, compassion. Everything should be in that when you're dealing with older New Yorkers. So yeah, I've seen the problems. We have to make sure the understaffing of some of our, when we do have people that do have to go into facilities, because sometimes they do. These places are understaffed. They just don't have the staff. And we have a nursing shortage all across the board. So there are other things that we're not paying attention to that are impacting what's happening with older New Yorkers. One of the things that I was able to do is really fund and support a program called Skill Spring to help deal with the shortage of caregivers, where we are actually training high school students to become CNAs. The program has been very successful. It started at a nursing home in my district, It's now a pilot program for the state. We are trying to get them even more funding because it's an answer to so many problems. It's an answer to the shortage in the workforce, but it's also a pipeline. It is a pipeline to get more nurses. It's also a way to give income to young people who need that income. Give them something that they can do even when they graduate, even if they want to go to college, and we hope they do. But if you don't, you have something already that you're working at, and it's been working out wonderfully since we've implemented that. But it just goes to what I said earlier. This is such a broad issue, and if we're going to resolve it, we're going to have to pay attention to everything that is connected to care and to older New Yorkers, including our NORCs. We have to make sure that we are supporting those, because I look at some of my NORCs, I got people in their hundreds. If we take good care of people, they can stay at home and live their lives, and they don't have to go into a facility. So that, I know you wanted to hear problems, but I gotta give solutions when I give problems. But thank you.
So, go ahead, Alice.
I was just gonna say, like, I hear frequently from our members about caregiving concerns. There's a situation in Queens in the last few months where someone was discharged from the hospital, and when they got home, their home was not in the condition, bed bugs, mold, no running water in the middle of the winter. So I think, and that is a very complicated situation, but the solution to what the senator just said is really clear. Like, we have mounting problems in this world of like political strife and climate change. This is a problem we can solve.
Yes.
Like with funding and with attitude and with, the right research and understanding and services. Like, this is not rocket science. This is about getting people the things that they need so that they can live their best life at whatever zip code they live in, whatever ability they have. So I feel like that should be a high point for us, that we can solve these issues.
From AARP's perspective of hearing stories, we talk to our volunteers, and we also do surveys, not only here in New York, but all across the country. And most of the survey answers come back that AARP members and older persons in general, they want to stay in their home. They want to stay there as long as possible. And if they need care, they want someone from the family to provide it. And then when we survey the actual family caregivers, they are very stressed out. We have an example. On average, it's $7,000 out of pocket for a family caregiver to keep someone at home. And you can see from the surveys and the questions and the answers coming back, the family caregivers in New York are stressed. They're financially stressed, they're emotionally stressed. And when we see that as AARP staff in New York, that drives us to work on policies and funding to take care of family caregivers. So there's hundreds of stories, as everyone knows, that is out there. And to Allison's point, the formula for success here is very easy. We know people want to stay at home. We know family caregivers have a role in that. They are the backbone of the long-term care system, family caregivers. So why don't we provide them with the resources to keep their loved one at home? And on the back end, it saves all of us tax dollars money, because those individuals, if we keep them at home, they don't go to nursing homes, which is funded by all of us. So it's I agree with you, Allison, it's a very simple formula, and it is very achievable.
It all comes down to resources.
Yes.
And the New York Foundation for Senior Citizens is providing a home sharing program and respite care. But really, it comes down to priorities and dollars. And this last November, you all voted to approve the Equal Rights Amendment, which I carried in the Assembly. And it includes anti-discrimination language against the elderly, talking about ageism earlier. And so we need to continue to press forward. Our elderly population is our largest voting bloc, and we need to capitalize on that by putting resources into our aging and our home sharing programs and our nonprofits, and putting more grant funding out there.
And I would agree with all my colleagues. I would say, if you ask the question, what is broken in our care system currently, it is the direct care workforce issue. And there's not many times where you see advocacy organizations completely align, because we typically have to fight for funds for our sector. The disability community, the Medicaid community, the hospital community, the nursing home community, the aging community, all collectively have identified the direct care worker shortage as being the #1 issue for any service organization, but more importantly, for any caregiver. If you can't get somebody to come into your house and help you, if mom, dad, or a child needs a bath and you can't physically do it, we have a broken caregiving system. And there are areas all over the state of New York where there is absolutely zero availability for a home care worker to come to your home, regardless of what you have for resources or a payer source. It's the same thing in our skilled nursing facilities. We talk about the number of complaints, the work our ombudsman program does. Almost all of those are associated with a lack of direct care workers. And it's time for the state and the country to finally stand up and say, we value these workers more than a fast food retail job. They are doing the hardest work that exists. They do it with very little pay and with really strong hearts. And it's time for us to stand up and do something about these deplorable wages that they are paid.
I guess this question is a little self-serving, but I am curious, I'm only 25. I guess by the time I'm retirement age, will this infrastructure and this caregiving system in New York be there for me? Do you imagine?
I think we have to say yes.
Yeah,
I mean,
Please do. Yeah.
Well, let's say it's up to you and your age group too. Like I said, I always tell people, you will be in this group one day. So I'm not just preparing and doing things for people who are seniors already. We have people coming up, and this is what we have to prepare for. And it goes back to what was discussed earlier. There has to be an awareness of this. Seniors can't be invisible. There has to be an awareness. We have teenagers, we have babies, we have people who are middle-aged, but we also have older New Yorkers, and we have to prepare for that segment of society too. Yes, it will be here for you. It will. And it'll be even better.
Be a sad state of affairs if it wasn't.
I agree. Well, I believe we're coming up on time. This has been a pleasure. Thank you all for attending with us. Is there anything else you guys would like to share?
I would just, from AARP's perspective, thank you for the volunteers that showed up at the forum today, and thank you for getting on a bus to come lobby your legislators. And so really appreciate that from AARP. And thank you for City and State putting together this forum with our members here. Thank you.
Thank you as well. Thank you for this. Thank you, AARP. Thank you, volunteers, for today and all the other days that you come up here. I love to see you because there's so many things competing for our attention. There's so many things that we're focused on and paying attention to. When you come, you ground everyone and you make sure that they remember that what Chair Seawright is talking about and what Chair Clear is talking about, this is important, and you put a face to everything. So that's so important. I can't tell you the value of you and your organization coming up here all the time and being present.
We'd like to see you every week up here. So come back. Yes. Thank you.
thank you.
Yeah, let's give a round to our amazing panelists.
I want to thank everyone who came today, and I thank Austin for moderating. Everyone, I'm Ralph Ortega. I'm the editor-in-chief at City and State. Thank you, AARP, for this incredible event, and I hope you enjoyed our program today. Please check out our event schedule. Hope to see you at the next City and State event. Thank you.
Oh, yes.